Hello, everybody. Good afternoon. Thank you once again for joining us this afternoon for our webinar for NLAAD 2018, our third webinar of the series this year, the impact of HIV on Puerto Rico. I'm Luis Alberto Mares, Director of the Mobilization Programs at the Latino Commission on AIDS, and our presenter today is Lizeth Marrero, the Regional Resource Consultant for the U.S. Department of Health and Human Services. Lizeth, the Regional Resource Consultant for Regional Network Program, supports the U.S. Department of Health and Human Services in the Office of the Assistant Secretary for Health to create a coordinated effort in the federal response to HIV and viral hepatitis, to provide technical assistance, training, education, outreach, and support within New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. Lizeth began her career as a school health project associate at CIECUS, the Sexuality Information and Education Council of the United States, focusing on the sexual health of youth and the advocacy of national and comprehensive sexuality education around the United States. From 2001 to 2016, Lizeth served as the Deputy Director and Administrator at the Adolescent AIDS Program at the Children's Hospital at Montefiore Medical Center in the Bronx, providing comprehensive medical and mental health programs to HIV-infected and LGBTQ youth. Lizeth received her bachelor's degree in psychology from the City College of New York and a master's of social work for the Silverman School of Social Work in Hunter College. Before we go ahead, just to let you know that the lines have been muted to avoid noise interference. You can also share your comments and questions in the chat box in the lower part of the screen, and this meeting is being recorded. So, Lizeth, go ahead.
Thank you, Beto, so much. Good afternoon, everyone, and thank you so much for joining today's webinar on the impact of HIV on Puerto Rico. And I'm always honored to collaborate with the Latino Commission on AIDS, as well as everyone who has joined us today throughout the United States to learn about what's happening currently in Puerto Rico. So I'm going to try to advance. I think I'm having trouble advancing.
I'll do it, just for me.
Okay, you'll do it. Okay, thank you. So just to give you a little bit more information in terms of the program that I'm currently with, the Regional Resource Network Program coordinates a response to HIV and viral hepatitis, and we focus on prevention, education, outreach, and stigma reduction that's targeted to racial and ethnic minority communities. And we do that in order to develop valuable partnerships and provide support to regional and local stakeholders. The Regional Resource Network Program operates out of the Office of the Assistant Secretary for Health, which is part of NHAS, and works to optimize the nation's investment in health and science to advance health equity and improve the health of all people. Next slide. So today's webinar is going to focus on 5 major areas: the history of HIV in Puerto Rico, epidemiology, Puerto Rico's response to HIV/AIDS, barriers to diagnosis and care, and the integrated plan for Puerto Rico 2017 to 2020. Next slide. So for those of you who may not know a lot about Puerto Rico, but you have interest and you have traveled there, I wanted to kind of give just a little bit of a summary just so that we have some context before we actually dive right in and talk about the HIV crisis in Puerto Rico. So Puerto Rico is an island or archipelago in the Caribbean Sea. It's made up of 78 municipalities that include 2 additional inhabited islands. Most of you have heard of Vieques and Culebra. And also there are a number of uninhabited islands on the side of the coastal line of Puerto Rico, Isla Mona, Monito, Isla Desecho, Caja de Muertos, and many other islands and keys that make up all of Puerto Rico. The capital and the most populous city, and I would also add to that the most touristy city, is San Juan. Puerto Rico's official languages are both Spanish and English, and a lot of people don't know this, but English is taught from kindergarten all the way through 12th grade, and of course in the colleges and university. But Spanish is the most dominant language. Puerto Rico is a commonwealth of the United States, and all of its residents are U.S. citizens. There are approximately 3.3 million people living on the island of Puerto Rico, but in 2006 there was a massive exodus as a result of the economic and fiscal crisis. And from about 2006 to 2016, the island lost over 500,000 residents, so that's about 14% of its population, which is pretty astounding. And more recently, as a consequence of the destruction caused by Hurricane María that hit the island on Wednesday, September 20th, 2017, more than 135,000 Puerto Ricans have relocated to the mainland. Next slide. One more back. No, I'm sorry, the one with the flag. Yeah, there we go. Thank you. So now we're going to really dive into the history of HIV/AIDS in Puerto Rico, and we're going to look at it from the beginning of the epidemic to where we are currently, and I'm going to provide you a lot of data to give you a very clear picture. I didn't want to do a snapshot. I felt like it was imperative for us to really try to look at the data and talk a little bit about the analysis of that. So cumulative surveillance data from 1981 to 2017 shows a total of 48,789 cases of HIV that has been reported in Puerto Rico. So 98% resided in Puerto Rico at the time of their HIV diagnosis, and 78% of the total reported cases have progressed to stage 3 of HIV infection, which is an AIDS diagnosis. Cumulatively, there have been 28,663 deaths of people living with HIV on the island, and 18,627 persons diagnosed with HIV resided in Puerto Rico at the end of 2017. Of that number that I just mentioned, the 18,000, men represent 74% of the cases. 34.9% of the diagnoses occur between the ages of 25 and 34, and 42% of the diagnosis occurred among injectable drug users. And 671 children from 0 to 12 years of age have been diagnosed with HIV in Puerto Rico, again, cumulatively. But of that number, 87% of those cases were due to perinatal or mother-to-child transmission. But the good news is that since 2012, there have not been any cases reported of children being born with HIV on the island. So that's a great thing to know, and that is in line with some of the other states of the United States that have really tried and tackled the elimination of mother-to-child transmission. Next slide. So here's a timeline of the HIV epidemiology in Puerto Rico, again looking at the same date from 1981 to 2017. And so in 1981, Puerto Rico diagnosed its first case of AIDS. In 1987, AIDS reported started in Puerto Rico. In 1993, they established a more comprehensive and expanded definition of AIDS. In 1996, there was the introduction of ART, antiretroviral therapies. In 2003, HIV reported starting in Puerto Rico. In 2008, there was a more comprehensive and expanded definition of HIV. And in 2014, electronic laboratory reporting started on the island. So now that I gave you that timeline, I want you to take a look at the actual chart and look at some of the kind of lines that are going up and down, as well as some of the bars in blue. So what we see when we're looking at this chart is that there was a steady rise of AIDS diagnosis that is depicted in the red line. And then also a steady rise in the deaths, which is depicted in the green line. And from the beginning of the epidemic through 1996, we see a steady decline, which is great. That's what we want to see. The orange line shows HIV diagnosis with no AIDS, and the light blue and dark blue bars that we're seeing going up and down show HIV and AIDS prevalence, which continues to rise. Next slide. In 2016, the rates of diagnosis of HIV infection among adults and adolescents by area of residence in the United States in 6 dependent areas was 14.7 per 100,000 population, with 40,202 persons as the annual number of new infections in the United States at the time. Puerto Rico ranked 9th among U.S. states and territories for diagnosis of HIV infection among this particular population, with a rate of 17.8 per 100,000 population. That is a rate that is higher than New York. So what I want you to do, I'm going to kind of go through this, but I want you to look at this slide and see where I circle where it says Puerto Rico 17.8, and then I'm going to just kind of mention some of the other states that are in the darkest blue, which is the highest rate, and just kind of show you how the rate is higher than some of these major cities and states. So higher than New York, if you look at New York, it's 17.2. Again, keeping in mind that Puerto Rico was 17.8. Mississippi, 17.1. North Carolina, 16.5. New Jersey, 15.2. California, 15.2. And Delaware, 14.5. And this may be shocking for some folks. For other folks, this may be like, yeah, I kind of knew this. And it reaffirms, why there's so many issues and struggles in Puerto Rico. But as I was going through the data and looking at it, I was just kind of like, I was taken aback by some of these numbers. Next slide, please. So going 1 year back, at the end of 2015, Puerto Rico ranked 6th among U.S. states and territories for adults and adolescents living with diagnosed HIV infection in the United States at a rate of 564 per 100,000 population, compared to the total U.S. rate of 364.3. So again, higher than the U.S. rate, and also higher than Louisiana, which is 504.7, New Jersey, 473.7, Delaware with 404.9, South Carolina, 394.6, California, 376.4, Mississippi, 374, and Nevada, 371. Next slide. Just to put it in perspective for you in terms of what I'm presenting and what they're dealing with, Puerto Rico ranks even higher than Texas, the largest state, which had a population of over 26 million residents and is 268,820 square feet, 20 square miles, not feet, sorry, 20 square miles big, compared to Puerto Rico, which is only 3,515 square miles. Puerto Rico can fit inside of Texas approximately 76 times. Even with adding neighboring islands like Turks and Caicos, Haiti, and the Dominican Republic with Puerto Rico inside of Texas, you will see that there is still room to fit Jamaica, Cuba, the Bahamas, and probably all of the lower Antilles Islands. While Puerto Rico ranked 6th in 2015 with a rate of 564 per 100,000 population, Texas ranked 14th among states and territories for highest number of cumulative AIDS cases, diagnosed rate, and HIV prevalence, with only a rate of 368.9 per 100 population. Next slide. So to add even more, we see from this slide and this map that Puerto Rico ranked 10th among U.S. states and territories for stage 3, which is an AIDS classification among adults and adolescents with HIV infection cumulatively by area of residence through 2016, with 34,919 residents with an AIDS diagnosis cumulatively, right? So it's over time. But again, putting in perspective for you folks and looking at that map and looking at the dark orange, brownish color, which are the highest rates throughout the nation, and looking at the size of those states, Puerto Rico's rates were higher than Louisiana, which seems to be like a common theme, which we know that a lot of states in the South are dealing with disproportional rates, astronomical rates. But the point that I'm trying to make is that despite all of that is happening, Puerto Rico was still coming at a higher rate, which is really problematic. So again, those states are Louisiana with over 2,400 per population, North Carolina with over 2,400, with Massachusetts with over 2,400, with Virginia over 2,200, and D.C. with over 2,100. Next slide, please. So this slide is new HIV diagnosis and deaths for persons diagnosed with HIV in Puerto Rico between 2010 through 2016, showing that there is a 34.2% decline in new HIV diagnosis and a 37.8% decline in deaths among people living with HIV. So after I showed you all of those slides, we have some good news, right? So this is great. We still know that there's a lot of work that needs to be done, but at least we are seeing some kind of decline, which we're applauding. And the fact that, this is in line with what we're seeing nationally. So infection is going down and deaths are going down, which is great, which means that, several things like interventions, such as PrEP, should be working or is working. We can just make that assumption, that more individuals are on treatment, that folks are virally suppressed, and that this is impacting the epidemic in a good way and moving in a direction that it should be. Next slide. So this is just another look at AIDS diagnosis from 1999 through 2017 with a steady decline, but levels off, as you can see at the bottom, between 2015 and 2016. So again, just, with the hopes that with the increase of PrEP and more education on viral suppression and U equals U, undetectable equals untransmittable, that these numbers will continue to go down. Next slide. Here is HIV diagnosis by age and data, showing more HIV acquisition in individuals between the ages of 25 to 54, with a greater number of infections in the 25 to 34 age range. The 35 to 44 age range follows right behind, and then 45 to 54, indicating that these are definitely the target age groups based on transmission, and it's transmission across the board, so all categories, right? So sexual transmission, transmission because of injection drug use. So keep all of that in mind as we go through the next few slides. But what I wanted to mention here was that, the hope is that there are HIV prevention interventions going forward that are addressing, and emphasizing sexual and behavioral health, and not just looking at one model versus the other, but really coming from a very comprehensive approach. Next slide. This slide shows HIV diagnosis by sex, including all modes of HIV transmission for individuals ages 13 and older. And again, we're seeing similarly to what we're seeing nationally, in that men have a higher HIV acquisition. And since all of this is for all transmission categories, again, just highlighting the need to be targeted with our prevention interventions and focusing on both sexual and behavioral health. Next slide. This slide shows AIDS diagnosis by age for all transmission categories. And again, we are seeing that individuals with an AIDS diagnosis are between the ages of 25 and 54 years of age, with a higher rate in the older population, 45 to 54. Next slide. And the last bar graph, this is the last one, shows AIDS diagnosis by sex based on all transmission categories, with more men having an AIDS diagnosis. Next slide, please. So this map of the island shows people living with HIV and AIDS by municipalities in Puerto Rico, with the majority of the cases that you'll see in San Juan. So that's the right of the island towards the corner at 4,492, as well as the metro area, which consists of Carolina, Cataño, Guaynabo, and Trujillo Alto, with 2,356 cases. Then what follows from that is Caguas, with over 2,300 cases, Bayamón with over 3,100 cases, Ponce with over 2,500 cases, and Arecibo with over 1,500 cases. Next slide. So this is the most current HIV care continuum for Puerto Rico from 2013. And so we're going to go from left to right so that you can understand. And from my computer, some of the text in the arrows look small. I'm not sure if you're seeing it small, but I'm going to just make sure I go through it so that you're all clear what this is talking about. So the first bar is people living with HIV, and that's 18,386. So those are people that tested for HIV and know their status. So that's why you see 100% there. And that doesn't indicate that everyone living with HIV on the island knows. These are only for those who have tested and know their status. Of those, 13,043 were linked to care, so that's 70% or 70.9%. Of those linked to care, 11,882 are retained in care, so a little over 91%. Of those retained in care, 10,441 were on antiretroviral therapies, so that's 87.8%. And of those on antiretroviral therapies, 8,383 were virally suppressed, so 45.6. Now, the universal goal is 90-90-90. So what that means is that by 2020, we hope that 90% of all people living with HIV will know their status, that 90% of all people with diagnosed HIV infection will receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapies will have a viral suppression. Now, if we look at, which I don't have here, but if we look at the U.S. HIV care continuum, and the one that we go based on is 2014, the U.S. is not there yet either. So we have about 85% of those living with HIV knowing their status. We have 62% receiving care. We have 84% retained, and 49% who are virally suppressed. So, Puerto Rico is kind of in line with what we're seeing nationally. So in order for us to get to that universal goal of 90-90-90 by 2020, which is really right around the corner, there needs to be a lot more you know, focus on all of the interventions that we currently have. What do we need to do to routinize HIV testing? What do we need to do in order to make sure that doctors are offering the test, that people are educated, and asking for the test if providers are not offering the test, and that it becomes so normalized that it's just part of our everyday screening. And so that's obviously a policy change in terms of how the states roll out testing and how, you know, hospitals roll out testing. So still a lot of work needs to happen in order for us to reach our 90-90-90 goals by 2020. Next slide. So here is a drill down into linkage of care for people living with HIV by transmission and sex in Puerto Rico for 2016, which helps us understand where the cascade is going when we think about the 2020 goals. So in 2016, 71% of women who acquired HIV acquired it through heterosexual contact and were linked to care. 63.5% of men who acquired HIV through sex with men were linked to care. 63% of men who acquired HIV through heterosexual contact were linked to care. 57.7% of men who acquired HIV through injection drug use were linked to care. 42.9% of women who acquired HIV through injection drug use were linked to care. So we're still seeing some low numbers, but still there are a lot of efforts in terms of, you know, what they're currently doing to try to identify folks, link them to care, retain them in care, get them on antiretroviral therapies, and ultimately get them virally suppressed. Next slide. When looking at Puerto Rico's response to HIV/AIDS on the island, the Health Department of Puerto Rico conducted an inventory of HIV service providers in 2014 and found that there were 102 organizations providing services related to HIV and sexually transmitted infections. These entities provided services to the general population and those who are at high risk of HIV infection and sexually transmitted infection, specifically men who have sex with men, youth, older adults, homeless individuals, LGBT folks, people living with HIV, injection drug users, and heterosexuals. These programs are using a multidisciplinary approach that includes an array of health professionals, including physicians, health educators, case managers, clinical professionals, and behavioral health professionals, among others. Puerto Rico is also part of the Northeast Caribbean AIDS Education Training Centers, also known as the AETCs, which is a national network of leading HIV experts who provide local-based tailored education, clinical consultation, and technical assistance to healthcare professionals and healthcare organizations to integrate high-quality, comprehensive care for those living with or affected by HIV. Next slide. So in 2016, the AETC conducted an assessment to identify the top 10 challenges regarding HIV services on the island. Those challenges include retaining and re-engaging patients in the healthcare system, mental health and substance abuse service integration, the implementation of practice transformation and team-based care, health literacy and communication, HIV stigma, using data to improve care and treatment, the integration of prevention and care services, primary care and specialist role and collaboration, the diversity of providers, and I would add to that the loss of doctors on the island. And according to the current health secretary of Puerto Rico, this is happening at a rate of 1 doctor a day, and this was prior to Hurricane María. And then lastly, PrEP implementation. Next slide. Additional challenges that exist are funding sources to ensure continuity of care. Puerto Rico currently receives funding from the CDC, HRSA, HUD, SAMHSA, and some state allocations. But one of the things that I do hear sometimes is that, you know, there is not a big push for going for other funding that may help enhance programs, and that sometimes organizations only go with the funding that they know that they're going to get. Other challenges that exist are transgender-specific services or lack thereof. When I went to Puerto Rico in March, I visited a amazing organization called Centro Ararat in San Juan. They also have clinics in Juana Diaz and Ponce, and their transgender clinic is called Clínica Translucent. But this is not the case throughout the entire island, right? So there's still a lot that needs to be done to not only address HIV stigma, but also to address homophobia and transphobia throughout the island. There is also the limitation of HIV reporting. Anonymous testers do not report to the Puerto Rico surveillance system. And adequate support services like housing as a result of, or lack thereof, right, loss of housing as a result of the rising fiscal crisis, and transportation, especially for those living in rural areas. And below I have put a few pictures regarding the housing situation in Puerto Rico, and this is post-Maria. So from the left to right, you're going to see tarps on top of houses in San Juan. So this has kind of been like the picture that has been ingrained in our heads, you know, in terms of the loss of roofs throughout the island. Then the center picture is from Las Marias. So these two men live with their parents and in a home that was high up in the hills. And this is in central Puerto Rico. And they're standing in which was once their living room. And this is only a few weeks after the hurricane in 2017. And then on the right, this is the inside of a beachside chinchorro, which is a small eatery, which lays in ruins. And this is near where the eye of the storm passed through during Maria. And this was taken actually this past March in 2018. So next slide, please. The Puerto Rico HIV Integrated Plan examined barriers that are associated with access to care services. Those barriers are public policy. An example of that is the healthcare plan coverage that currently exists, staff capacity, training development, and the administrative process, programmatic issues related to funding, service providers' lack of resources and expertise, social determinants like poverty, cultural issues, stigma, transportation, lack of stable housing, homelessness, and comorbidities. And after Hurricanes Irma and Maria, as you all know, many of the towns were left without electricity, running water. There were flooded streets that added to the existing barriers, making it virtually impossible for clinics to provide care or for patients to get to their appointments and to receive their medications. And let's just remember, just across the board, that, you know, HIV is not the only health concern and health issue on the island and that people have to deal with. And for those with compromised immune systems, this waiting period to get your electricity on, to get water, and to other things that are just the basic necessities, you know, food, water, shelter, medications, and the introduction to some waterborne diseases became dire, right? And as a result, thousands of people died. Next slide. The Puerto Rico HIV Integrated Plan also examined healthcare issues. So there are three overarching themes that had emerged. The first one is structural changes included the weakening of Puerto Rico's public health infrastructure, demographic changes, and economic instability. The payment environment, which includes the dependency of the Commonwealth private and public health care system on Medicaid and Medicare managed care funding, and the relative absence of a commercial insurance base on the island. And lastly, quality of care, which emphasized the migration of physicians, which I talked about previously, losing one doctor a day, but particularly those specializing in obstetrics, gynecology, and endocrinology. Next slide. So knowing the history of the epidemic of Puerto Rico, the barriers to prevention and care, the major healthcare issues, it is important to highlight the framework being used in Puerto Rico to address the problem. That framework is the Integrated HIV Surveillance, Prevention, and Care Plan for Puerto Rico 2017 to 2021, which is in line with the National HIV/AIDS Strategy. So the first goal is to reduce new HIV infections, so going from 80% to 90% for people living with HIV who know their status. Reducing the number of new diagnoses by 25%, reducing high-risk behaviors by 10% and promoting PrEP, PEP, and MPEP. The second goal is increase access to care and improve health outcomes for people living with HIV. So increasing linkage to care for newly diagnosed persons within 1 month of diagnosis to 85%, increasing retention for newly diagnosed persons to 90%. The third goal is to reduce HIV-related disparities and inequalities in health. And that is to increase the percentage of youth and persons who inject drugs with diagnosed HIV who are virally suppressed to 80%, and to reduce geographical disparities in care for people living with HIV. And the last goal is to achieve a more coordinated national response to the HIV epidemic, to promote a public policy aimed at integrating the efforts for surveillance, prevention, and treatment of HIV. Next slide. So in conclusion, we cannot end AIDS if Puerto Rico is left behind. The burden of HIV infection differs for Puerto Ricans living on the island and is overwhelmingly disproportionate, with rankings higher than some of the largest states on the mainland. With economic, geographical, and post-hurricane barriers, working towards ending the epidemic in Puerto Rico makes it difficult to move the dial closer to ending AIDS. But as you see, they are doing it. It's, small incremental steps, but the picture shows that there is still a lot of work that needs to be done. And to address the crises in Puerto Rico, programmatic support that includes a peer-based approach, in-person education, and counseling outreach, as well as syringe service programs and social media outreach designed to reach the populations most highly impacted by the epidemic on the island, including injection drug users, women, homeless individuals, and youth, transgender persons, and men who have sex with men, must continue in order to facilitate the elimination of HIV stigma and discrimination, homophobia, transphobia, and work towards integrated and coordinated efforts to increase testing, diagnosis, linkage to care, prevention services that include PrEP and PEP, access to treatments, and the slow-moving mobilization, but it's there, of U equals U, undetectable equals untransmittable, to promote viral suppression for people living with HIV. And the message that those who achieve viral suppression will not transmit the virus to their partners, and emphasize the goals of HIV treatment are to improve overall health and to prevent the transmission of HIV. Next slide. So I would like to end my presentation with the words of Supreme Court Justice Sonia Sotomayor, who is quoted by saying, There are uses to adversity, and they don't reveal themselves until tested, whether it's serious illness, financial hardship, or the simple constraints of parents who speak limited English. Difficulty can tap unexpected strengths. So despite Puerto Rico's crises, whether that be HIV, economic, or due to natural disasters, Puerto Rico siempre se levanta. I thank you very much for your time and for tuning in today for this presentation. And I think now we are opening up for Q&A.
Yes, Lisa, thank you very much once again for always supporting and collaborating with us in NLAAD, and thank you for presenting this very comprehensive overview of what's happening in Puerto Rico in terms of HIV.
Thank you.
So there are some questions already. Emilio Herman asked, what percentage of those individuals living with HIV diagnosed in Puerto Rico is attributed to men having sex with men?
So again, say that one more time. I didn't understand the question.
They want to know if the risk of getting infected with HIV is predominantly related to sex with men, sex with men.
So in Puerto Rico, it's just it's slightly different than what we're seeing on the mainland, where the highest risk behavior is men who have sex with men. In Puerto Rico, we are seeing HIV attributed to same-sex sexual behavior, but we're also seeing a high influx, and this has been for a long time, of injection drug use. And sometimes with the data, they don't parcel out, and sometimes they kind of lump things together. So I would say from what I looked at, it's both. It's injection drug use and men who have sex with men.
Okay. Another question is, to what do you attribute such low, 45.6%, viral load suppression to in Puerto Rico?
Yeah, I mean, well, you know, we're seeing that too in on the mainland. It's the fact that, you know, it's hard to retain people in care. We're seeing large levels of folks getting tested and being diagnosed, but retention in care is a challenge, and it's a challenge across the board. And, you know, when you have natural disasters, that makes it even more difficult for people to get to their doctor's appointments. And we also have a lot of doctors and specialists who have left the island. So it creates a recipe that doesn't work and doesn't help move the dial closer to ending AIDS. So I would say it's a lot of social determinants, a lot of social issues. I think there is still a lack of education. I think there is a major difference between what's happening in the major municipalities like San Juan as opposed to what's happening in some of the rural pueblos in Puerto Rico, that there is absolutely a huge disconnect. And really, it's like when you're in San Juan, and then you drive to the other side of the island, you drive to Aguadilla, and you drive to Mayagüez, and you drive up into the hills. It's just like a totally different world, and how that communication happens, and how that education happens, and how access to services happens differs, and transportation is also a major, major barrier.
Is there any strategy in place to ensure the percentage improves? The viral suppression percentage?
One more time, because you're cutting up, so it's hard to hear it.
The question continues, what strategies are in place to ensure that this percentage improves?
So it's really the health department working with the community-based organizations to ensure that you know, people are going out and trying to locate those who are not retained in care. And, you know, I met with the health department. I met with other programs like Pacientes SIDA por Política SAN. I met with Araras. with Puerto Rico Concra. And so, they're doing their best to make sure that they try to continue to engage folks and to educate them. But if there's someone who is in a rural part of Puerto Rico, in order for them to get to their 3-month visit, it's difficult. And if they're dealing with other issues, they are not going to prioritize their treatment and their care. So I think for those who are engaged in care, who are retained in care, who are on their medications, are doing fairly well. So there's a lot of outreach that's happening, especially in terms of syringe exchange programs throughout the city, but getting to those rural areas, again, it's difficult. It's really a geographical problem. It's if it was a flat island and there was a train that went from the north to the south, from the east to the west, it would really change the dynamics on how HIV treatment is delivered.
Thank you. There's a question from Ernesto Hernandez. He says, I know there were some big issues in terms of antiretrovirals distribution after Hurricane Maria. Has the distribution been completely restored? Also, I know many people left the island after the hurricane. Do you have any information on the number of people living with HIV who may have left? Any info of where they may have headed on continental U.S.?
Really great question, Ernesto. From my meeting back in March, when I met with those organizations, as well as when I met with the AETC, I was told that everything was restored in terms of the distribution of medications because the pharmacies were up and running, and the clinics were up and running. So the answer to that is yes. But in terms of the actual numbers of people living with HIV who left the island, I don't have those numbers. I just have some anecdotal data. A lot of people went to New York, to Chicago, to Atlanta, so the major cities, to Miami, to Orlando. But I was also hearing that people were also going back to the island. So I don't think that those numbers will really know for a little while.
Jorge Benitez asks, how has the Hurricane Maria impacted adherence to antiretrovirals with the lack of resources?
So at the time, again, like I said, right after the hurricane and up until maybe 6 months after, it did impact adherence to antiretroviral therapy because people could not get to their doctor's appointments. So, for those who had achieved viral suppression, if you can't take your medications and if you had a low supply and you had to spread them out, that is going to definitely impact your viral load and your T-cell count. And I know there was a lot of work that was happening in terms of mobilization and trying to get folks into the clinics, and if not, that there was some kind of what we call visiting nurse services, but that they were really trying to provide as best as they could some door-to-door services to check in with folks because the phones were down. There was such a poor infrastructure for so long, it did make an impact. But what I have been informed is that has gotten better over the last few months.
Another question comes from Agustin Morales, and he says, I came in late to the presentation, but I am wondering how big a role telemedicine plays in getting a specialist recommendation for this population given the loss of physicians in the island.
Great question. I have not heard of any programs that are providing telemedicine. AETC is out of the University of Puerto Rico, which is a major university. That was never, ever a program or anything that was mentioned. Granted, I did not ask that question, but I'm sure if this was a service that was being implemented throughout the island, that it would have been something that they would have reported.
Another question comes from Jorge Benitez. What can mainland U.S. advocates do to help to fight HIV in the island?
Oh, you guys, you can do a lot. You can create MOUs, memorandums of understandings, and linkages with the programs on the island. A lot of the programs on the island kind of feel like they're by themselves, and so they would love to make connections to programs on the mainland. In terms of education, I think one of the things that I have been speaking to Beto about is, how can we do a webinar in Spanish specifically for the organizations in Puerto Rico and get some of the experts that are on the island to talk about this firsthand. They are a wealth of information. So I think that collaboration is going to be major. If any of your programs have grants, I would say promote them to Puerto Rico if you can. If there's a way to do kind of a bi-regional collaboration and educational seminars, I think that there are so many opportunities. But I would also say that there are a lot of programs that are out there. I think Betsy Morales is on, and Hispanic Federation has a lot of services in Puerto Rico, and that there are ways to get involved and to volunteer on that level. It doesn't have to just be for HIV services. It could be for the rebuild. It can be for so many things that are lacking currently on the island. And yes, it's a year later, but they started out with such a bad infrastructure to begin with, and the hurricane exacerbated everything. So I would say reach out to the organization, reach out to the Hispanic Federation, and find out how you can get involved.
Another question comes from Angel Armenta. Is there any information or studies of those who have left Puerto Rico, if they are able to meet their needs or able to access health services, in regards to all the barriers they may be encountering, like language and financial? What is the best place for them to look up for help?
Another great question. So as you know, studies take a long time. So I don't have access to that information. And if they are currently evaluating that, we're probably not going to know for another 2 years. So I would say that I'm trying to be careful in how I respond to this question in terms of where the best place to look for in terms of help. I mean, there are a lot of resources on the mainland. We're talking about, getting people on Medicaid, Medicare. We're talking about, public assistance services. We're talking about, educational resources, the public educational system. We're talking about social services. There's so many ways that people can access information if they're from Puerto Rico and they came here. I know a lot of families who left had family members on the mainland, and for those that didn't, obviously the struggle is more intense. So in terms of research studies, the University of Puerto Rico, a lot of other organizations, Harvard, there's a lot of places that are doing research, but we're not going to have access to that information. And again, I'm going to just keep on plugging the Hispanic Federation because they're doing some amazing work in Puerto Rico, and I know that they'll be able to answer those questions as well.
One question from Luz Reyes. If you have any information on how does the faith community identities, churches or faith-based organizations, are responding to help with the education, testing, and prevention in Puerto Rico?
So, the community-based organizations do work with the faith-based communities, and they do a lot of collaboration in terms of events and working towards, providing testing in the communities and prevention. So the health department in Puerto Rico can connect you to those organizations. But I think that after the hurricane, there was such a mobilization, there was such resiliency, and there was such a big, effort to make sure that people were well. And the faith community really did so much work in terms of the revitalization that is happening in Puerto Rico, building homes, building churches, providing community and sermon. So there is tons that are happening, and if you want to get very specific, that's something that I can maybe get you offline and speak to some of my contacts and see if there's some churches that can get the names of some churches. I know that there's a church in the Bronx called Fordham Manor who right after the hurricane started sending their parishioners to Puerto Rico, and they go every couple of months for home restoration and revitalization of the homes that were destroyed in Puerto Rico.
That was the last question, Lisette. Before
wow.
I just want to remind everybody, please join us next week for the fourth webinar. This is going to be about the national efforts in different parts of the country to end the epidemic. But a little bit more information on New York. The presenter is Joan Moore, the director of the AIDS Institute in the New York State Department of Health. Also, please, all those organizations that you represent are going to have NLAAD events. Register your events on our website, www.nlaad.org. You can also request HIV tests. We have INSTI, OraSure, and Alere for your events. That's it. Thank you very much, Lisette, once more for your support and always being eager to cooperate with NLAAD and the Latino Commission on AIDS.
Thank you so much for having me. It's my pleasure, and I want to thank everyone again, and enjoy the sunshine.
Puerto Rico se levanta. Nos vemos.
Exactamente.
Thank you, everybody. See you next week.
Bye-bye.